So this is William Munoz, and we are going to do the distortion analyzer for SOT. First, we're going to have our patient, they could be facing sideways. And what I want to do is I want to take my thumb and I'm going to point it at the coracoid process, and we're going to look for sway, A to P. If he has A to P sway, we're looking at a cat 1. And we're going to have the patient turn to the side, or actually facing away from us, and we're going to point our thumb at the S2 tubercle, and we're looking for lateral sway, which could be indicative of cat 2. And yeah, so from there we're going to go into looking at the first rib. So we're going to palpate the rib head. And we're going to have the patient, can you flex your head forward and then extend it backwards? Do that one more time. And what we're feeling for is we're looking for the rib motion. So if we have unilateral or bilateral rib motion, that's going to be indicative of cat 1. Tender, unilateral tenderness on the rib head would be cat 2. And no motion whatsoever could be indicative of cat 3. Okay. So from there we'll go into cervical indicators. Have you go face up for me. So what we're palpating for now is spinous process and lamina, and when we palpate, we're looking for the indicators for cat 1, cat 2, cat 3, and cat 1 would be bilateral C3 laminas. Cat 2 would be unilateral left side TVP at C4. And a cat 3 would be, you're looking for spinous process tenderness or lamina tenderness, which would correlate Lovett relationship to the lumbars. So you would have, if you had a tender spinous process in the cervical, it would relate to an inferiority in the lumbar. And if you had a TVP tenderness, it would relate to a rotational aspect in the lumbar area. So from here we're going to do cervical stair step, and what we're going to do is we're going to apply S to I with a P to A glide, and what we're doing is we're trying to find where these stair steps hit, and you're looking for 4 stairs, which C1. Or I'm sorry, stair 1 would be T1, C7. Stair 2 would be C6, C5. Stair 3 would be 3, 4. And stair 4 would be C1, C2. And when you're doing this and you feel some restriction at the stair 1 level, I want to check for anteriors on his thoracics from T1 to T4, and then if I find any restriction in any other spot, I'm going to do the figure 8. So go ahead and relieve those restrictions. Okay. And then from there, we're going to do basic 1, basic 3. So basic 1, we're going to take the pads of our fingers on all 4 sides. We're going to go lateral to the EOP and inferior to the superior nuchal line. And what we're going to do is just barely touch that area, and we're looking for evenness or even pulsations in all 8 fingers. So basically this is looking for balancing the CSF along with the pulse here. Okay. And then from there, we're going to go, basic 3. So basic 3 was, what we're going to do is go down the sagittal suture, and we're going to palpate the sagittal suture. We're looking for tenderness. And then from there, we're going to cross our fingers over on that spot, and we're going to push out, or we're going to push into it and lift. We're going to do this 3 times. And and then check for tenderness again. It should go away. From there, we're going to go into checking for psoas. So I'm going to have the patient put your arms up for me. Okay. So what I'm going to do is I'm going to make sure the patient's not wearing any watches or anything like that. In his case, this is fine because I'm not going to be contacting that. And I'm going to balance my feet. I'm going to pull at the wrists, close my eyes, bring the fingers or the hands together. So we're looking for obviously this change here. So we know that the psoas, we're having a tight psoas on his right side. So I'm going to go to the opposite side. I'm going to have the patient lift this leg up. I'm going to stabilize the knee, and I'm going to find the psoas. I'm going to use my hypothenar, and I'm going to have the patient take a deep breath in and out. And as he goes out, I'm going to follow him down. Deep breath in, out, and then I'm going to follow him down and hold. Deep breath in, out, and we'll do that 3 times. And then we'll come back and recheck again for psoas. And we're looking for an evenness on the psoas, which it is. From there, we're going to go to anterior iliofemoral ligament. So we're going to have the patient have their arm up, soft fist. I'm going to have you hold for me. I'm going to push down. Okay, strong. And then what I'm going to do is find his upper fossa. This is going to be along his inguinal ligament. And then, so I'm going to have you hold. Okay. Hold. Okay. And then we'll go to the other side. Okay, hold. Hold. And again, you want to use all 4 fingers, flat finger contact, and you're looking for a weakness. If you do have a weakness there, then yeah. So from there, oh, I'm sorry, I did that wrong. So that's not the anterior femoral ligament. That was the arm fossa test there. So anterior iliofemoral ligament test would be. Oh, that's right. So we're going to go down to the foot, and obviously you want to make sure you walk around the patient clockwise. You're going to get out of the feet. You're going to want to take the ankles and rotate them medially, and you're looking for one that doesn't rotate as much, which is going to be his right foot. From here, I'm going to go to the opposite side. I'm going to contact the iliofemoral ligament, which is 2 inches out, or which is superior and posterior to the trochanter. And I'm going to have the patient rotate your leg in, and then I'm going to hold this and rotate out. Okay, go in, out, and then in, and then on this last one, I'm going to have you rotate your leg really fast outward. Okay, go ahead. And then I'm going to pull and let off. So then from there, we'll go back and recheck. And we're looking for evenness, so we got that. And then with the arm fossa test that we just did, if there was anything that correlated there, that would actually push us into Cat 2. So since he's strong on all of those, we're gonna work into Cat 1. Okay. So you can go ahead and pause it. Oh, you're using mine? Use your phone. Yeah, right.